Hello and welcome to today's show. And today we're blessed to have with us Angela Genzale. Welcome to the show, Angela.
Thank you so much. Happy to be here.
So let's get started by having you tell the audience all about yourself.
Okay. So, Angela Genzale, I'm a registered nurse. I've been a nurse for 32 years. I work in the labor and delivery postpartum women's health arena, and I'm also a certified life coach. And the two combine really well because coaching women in labor is very similar to coaching women through other aspects of life. And that's what we'll talk about today.
Sounds great. So let's get started. You have several things you want to cover today. What's number one?
Well, I think on the topic of empowering women, I always relate things to my background in the labor and delivery area. And think we can take that and apply it to other areas of life. And when we talk about empowering, I always like to look at sort of the definition of what empowerment is. And empowerment is really to delegate or give power or control to somebody. So there's that word of control. It's also to give someone strength and confidence, and that confidence word will come up a little bit later. And
Okay.
self empowerment is really taking control of your life and making your own choices. And the reason that's important is I think when we talk about empowering women, we talk about giving them choice and control. Those are the top two things. And there's lots of research to back this up that women, particularly in the labor and delivery setting, when we talk about their birth experience, the primary thing that contributes to a positive birth experience is women who feel a sense of choice and control. And conversely, women who have a negative birth experience related to the lack of choice and control.
I'm really about empowerment between books and other things. That makes a huge difference because it does not make sense for people to be unempowered. So with my background, my dad, was a doctor back in the 70s, and I'm just so used to the medical field. Even when I was going to medical school, it was a matter of, medical professional here, patient here, and, they were told what to do, but they did not have the power, the ability to really participate in their health care. And so I think it is profound. It is vital that we teach people how to become empowered because they can play such a huge role in their own outcomes if they have the right tools.
Yeah, exactly. So, and when we talk about choice and control, a lot of people in the labor and delivery setting, we talk about a birth plan. I really call it a birth preferences sheet because if you have been involved in anything like building a house, going on a big trip, planning a wedding, whatever it may be, you know that unexpected things are going to come up. And you have sort of a plan. You have your priorities, you have your preferences. And so this can relate to other areas of life, but you have to also be prepared for obstacles that might come up and decision points, what choices you might have to make. And so I think that's one thing that we really advocate in the labor and delivery setting, which could relate to other aspects of life, is you have your plan, you have your preferences, you have your priorities, and you know your decision points where you're going to need to make some choices.
Absolutely. So having that information is really profound and it's very important. It's a very important step to moving forward because you're not just, kind of grasping for straws. You have a plan.
Right. And then when we move and we talk about more control, I think one of the primary things is really being prepared and looking at internal control versus external control. So, one thing that we can control in any situation, even in labor and delivery where it is such an uncontrollable event in so many ways, the one thing that we can always control in our life is our mindset, is how we're interpreting the situation and how we handle it internally. And so I really try to empower my patients to be prepared, to prepare their mindset on how they are going to approach their labor, how they're going to approach when things maybe aren't going according to plan. And that's something that I really try to teach my new grads as well, and the nurses that I train, is to always remind the patient they do have one thing that they can control in this situation, even when things can feel like they're spinning out of control.
The power of positive thinking is profound. I mean, even down to the ultimate outcome in a health situation, how a person handles it, thinks it through, and just deals with it can have a profound impact on the outcome.
Yeah. And the third thing that sort of relates to both of these with when we are talking about choices and control is communication. How do you communicate your choices, and how do you communicate what you want to control or how you feel that you have control in a situation? And I think that's something to be really mindful of. And again, this goes back to whether you're planning a trip, planning a wedding, building a house, communication is such a big key. And oftentimes in the labor process, our patients really aren't able to speak for themselves. And what I mean by that is they're overcome with pain, or they're emotional and they can't think straight. They're exhausted. All of these things happen. And so having a plan ahead of time of what your preferences are and who is going to be your advocate and who is going to speak for you if you can't speak up for yourself. Somebody that you trust, that you are aligned with in your values, can be a key element, is really thinking about that ahead of time and recognizing this is so overwhelming and you may not be able to even think about what it was that you wanted or necessarily verbalize it. Or you may be up against someone who's part of the care team, which has values or ideas that are not aligned with yours. And how are you going to be able to stand up to exert your power of choice and your power of control in those situations? Who's going to communicate that for you?
Certainly. So I'm going to put you on the spot here.
Okay.
So, of course, you're not going to use their real name. We're going to call the patient Stara 1 and Stara 2.
Okay.
So, Stara 1, if somebody remember from some time in your career that did not have the best outcome, mindset, or so forth, and if you could just kind of explain that case study and compare it to Stara 2, that everything went well, whether or not there are adversities to overcome, but Stara 1 and Stara 2, they went in very different directions. So I am going to give you a moment to think about that. And we're going to take a quick break, and we'll be right back to talk about that some more.
Let's do it.
Hey there, this is Coach Dr. Ann. Did you know that I'm among a tiny fraction, less than 1%, of doctors worldwide board certified in the groundbreaking field of lifestyle medicine, which is based on decades of research on natural ways to prevent, treat, and even reverse many common diseases? I want to invite you to check out my YouTube channel that focuses on just that, PTR Reset, for Prevent, Treat, and Reverse. You'll find sneak peeks, easy explanations of important health issues, fun animated videos, music videos with powerful health messages, and more, all designed to make health fun and easy to understand. Don't fear for your health, take control of it. Like, subscribe, and share with your friends. Your journey to better health starts now. That heart go boom, boom, brain gets shot, stress goes down. I'm the smoothest walker in town. Burns that cake, lifts my mood, puts me in a groovy mood. Step by step, I don't stop, feeling like I'm on the top. They say got no time, but I make it fit. A little stroll here, I'm as strong as it gets. With all these bodies on board, my heart's in sync and my mind's clear, like a well-tuned.
So welcome back to the show, and we were just getting ready to get into a couple of different interesting scenarios. So let's talk about, the diversity of outcomes, the way people handle things, situations, and so forth. So let's talk about a negative sort of situation and a positive.
Yeah. So oftentimes patients that are disappointed are patients that have a plan, and I'm thinking of a few in particular. And let's say they've decided to deliver at a birthing center or at home, and things go sideways. And now they have to come into the hospital. And the things are very different in the hospital. And if they have not prepared ahead of time for that possibility, that can be quite a surprise and quite a shock. And so not being open to being flexible. And I will say, coming into the hospital, a lot of patients are have had prior negative experiences, or there's a lot of mistrust of healthcare professionals. And I'll on behalf of medical professionals, I'll take some responsibility for that, because obviously I think we have made a contribution to that as well. But
Certainly.
it sort of puts us behind the eight ball right when they come in. And other times patients they have a plan, but they haven't prepared. And so they're like, yeah, I'm just going to go without medication and I'm just going to do this or that. But they haven't actually figured out a plan and done some research, maybe figured out hypnobirthing or gotten a doula, gotten excellent support, anything like that. And so they come in and now we're having to, they're unprepared. I guess that's the point, is they're unprepared. And that can make a huge difference, is somebody that's prepared, that's open, that's flexible, and that can communicate what's most important to them and what their fears are, what their anxieties are, and have that open communication so that they can figure out, okay, maybe I can't control that my baby's going to be delivered via C-section. What can I control? Can I do skin to skin in the OR? Can I ensure my baby isn't separated from me? Can I, if my baby has to go to the NICU, can I pump breast milk or hand express so that the baby can have that? Can my partner go? So it's, again, people that are able to find where they can have control and where they can have choices and be flexible and understand some things are out of our control. We cannot control when a baby decides to have a big deceleration of its heart rate and wave the white flag and say, hey, get me out of here right now. And so, but what can we do in those situations to help it be a positive outcome? If the patient has their mindset that anything other than a unmedicated vaginal delivery is a failure, they are actually setting themselves up for failure. Because if they don't get that, that is what leads to birth trauma and leads to patients, feeling like they did something wrong, or a blame of other people or of circumstances, when in reality, that's just the reality of birth, is sometimes things don't go according to plan.
And I recently interviewed a psychiatrist who focuses on women and the emotional flux postpartum.
Yeah.
I mean, it's profound. I had no idea that, she said that postpartum depression is more profound than a blood clot in the lungs as far as mortality. And I'm an internal medicine doctor, and I was floored. So the emotional state of a woman after she gives birth is huge, because how is she going to really be able to bond with and care for that child if she is struggling so much internally? And you made some excellent points in that, the mindset, what can you control? If you feel like you've done something wrong, you're a failure, you're anxious, you're depressed, and so forth, that can only serve to make that experience significantly worse. And it reminds me of that prayer, the serenity prayer. Give me the the wisdom to understand the difference between what I can do and what I can't do. And
Yeah,
once you
change the
realize
things I can and accept the things that I can't.
exactly,
And the wisdom just
perfect.
to know the difference. Yes, exactly.
Yeah,
That
I love
I've
it.
never really related that to labor and birth, but
Uh-huh.
I will from this point forward, because it's exactly that.
Okay, do
And
I get credit for that? So I'm that
yes,
doctor
you do. I will do.
expertise.
I will give you credit. One thing that's really interesting that I'll just mention as an aside, because we're talking a lot about labor and birth. One
Uh-huh.
thing that I have learned over the past about 15 years is the impact of a woman's ability to breastfeed, if that is their choice,
Mhm.
how much that also impacts their experience of birth and of motherhood. I never realized that connection, and I had a
Mhm.
great lactation consultant that worked at our facility and became a very good friend. She's since passed, but I always try to recognize that impact that she made on me and other nurses with this information, of it's not just, oh, it's okay, like they're not latching really well, it's okay, you just need to do this and this, but how women can internalize that there's something wrong with them, that they're not able to provide a basic need like food for their baby. And so that has really changed my practice. And again, there's certain things we can control, there's certain things we can't control. And so accepting
Absolutely.
that I can't control certain my anatomy. I can't
Mhm.
control my baby's anatomy, or maybe their developmental stage, or different things like that that can impact the lactation process. So just as an
And
aside.
it's really relaxing to acknowledge. I mean, my husband tells me all the time, you can't change that,
Yeah.
so don't spend time worrying about this. You have no control over it.
Yeah, exactly.
So
Exactly.
it just kind of takes a burden off, once you realize you're not a superhero and you can't fix it.
Yeah, exactly.
So
So
let's move
patient
on to your
two,
next point.
are we
Mhm.
going to talk about patient two?
Oh, yes, I'm sorry.
No, that's
Patient
okay.
two.
Yeah. So patient two uh, prepares for a birth. She does research. She figures out that the hospital or the birth center or the home birth is what is aligned with her values. She makes sure she's a good candidate, that she's not a high risk candidate trying to deliver in a low risk place. She has
Mhm.
communication with her provider ahead of time, so there's no surprises. So we've had patients that arrive that want to have a water birth, which we don't do at our facility. Um, we've had patients with twins that want to be on telemetry monitoring. We don't have the capability of that. Or patients that want intermittent auscultation, and yet because of some complication that they're having, they're not eligible for that. And so having these conversations ahead of time and making sure that your practitioner is aligned, and making sure that you do your own preparation. So again, whether it's like Lamaze breathing, hypnobirthing, there's so many different ways to help yourself if that is your goal. If your goal
Mhm.
is to go without medication or have low intervention, have your support team. They build their support team. If they know their spouse or partner is not the best person to support them, hire a doula. Bring a friend, a sister, somebody that you know is aligned with your values and that has the ability to support you in the way that you need to be supported. They have an advocate that is able to communicate if they aren't able to communicate themselves. They come in with their birth preferences, but they're open and they're flexible because they understand what the priorities are. They've thought about risks ahead of time, and they know, okay, I'm not planning to have a cesarean, for example, but if that had to happen, then these are the things that I want. Who can be with me? Can both my partner and my doula be with me? Can I do immediate skin to skin? Like those kinds of things. And so
Mhm.
again, just being prepared, being open, and being able to communicate so that you can retain some choice and control. Those patients have better experiences of whatever
Mhm.
the outcome is because they felt supported. And
Certainly.
we that kind of segues into the next couple of points. So we have
Okay.
choice, we have control, we have communication, and then we have collaboration slash care team. Who's the care team? Because, and we do something called team birth, which I absolutely love, and I wish that it was in every hospital, birthing center, all over the world, where we have set times where we come in, and at the beginning we go through and we basically make sure that there's a collective understanding of what the patient wants. And it is such a great communication tool. And as things are going on, we say, here's where you're at. Here's how things are going. Here's what we should continue doing. Here's things we're maybe worried about, just so you can kind of see what we're watching for. Here's things that you might expect. And here's the options. that we have at this point, and we make sort of a collective decision, which I absolutely love. And then number 5 that sort of wraps everything up is confidence. And the reason I bring in confidence is because the base word of confidence is fidir, and it means to trust. And so self-confidence is trusting yourself. So not only trusting your intuition. Oftentimes in labor, there are a couple of choices and either one is really fine. And I tell my patients, really, there's no right choice at this moment. Either one is fine. So what does your intuition tell you? What feels right to you? And sort of being able to tap into that, especially at this heightened emotional state. And when women are pregnant, I believe they are so much more intuitive. They know so many things about their baby and about, their body. It's just such a beautiful time. And their intuition is amazing. So I always try to give that credit, say, what does your intuition tell you? Let's just trust that and go with that. And then trusting the people around you, trusting the process. So there's a little bit more, external, but just really having a team you can trust wherever you are in the world, whatever situation you are giving birth in. If you have somebody there that you can trust and that supports you through the process, that can be, there's nothing better than that, to be honest. That's what patients tell me. And when I've been in a situation where it's just been me and I've had the opportunity to support someone through that, that's one of the greatest joys of my job. When somebody at the end is like, I couldn't have done it without you. Well, the truth is, of course they could have, but I'm glad that I was able to make it a little bit easier and provide that support.
This whole process is so overwhelming, so profound, so motivational. I mean, you just can't. There aren't enough words to talk about what a woman goes through, experiencing that.
Yeah. And we are capable of so much more than we realize. Women come in and they are capable of so much more than they realize. I've had patients that have been laboring for 2 days. I take care of them for 12 hours. I go home, I sleep in my bed, I have a nice meal. I come back the next day and they are still at it. And I'm just like, oh my gosh, I can't. It's unbelievable. And so I always tell people, you are so much more capable than you think you are. You have so much more power than you think you have. And when put to the test, like, you can muster up all of that great female energy and bring that forth and bring that power out and prove to yourself, what you're really capable of. It's the best job in the world.
Yeah, I understand. Thank you so much. You gave some very powerful and motivational information. And these things are important because most women are going to be there at some point. So how they handle it, can make all the difference in the world. So I want to thank you for that.
Thank you so much for having me.
Oh, it's my pleasure. How do you want people to reach out to you?
The best way to reach out to me really is on Instagram. And it's just my name, Angela Genzale, all one word, and then _coaching.
Sounds great. Okay. Well, thank you so very much for being here, and you have a blessed day.
All right. Thank you.